Hello. In this short topic, I will discuss about BCG vaccine scar, especially what if BCG does not leave a scar after vaccination, and does it mean failed vaccine, or do we need to repeat the vaccine if there is no scar? So I will discuss about those issues. As introduction, tuberculosis is a serious public health problem, and the BCG vaccination remains an essential part of TB prevention strategy, especially in children. BCG vaccination should not be considered a sole means of TB control. Rather, BCG is used to protect against the severe form of TB. So always we should not forget that BCG vaccination should not be a sole means of TB control. We should have to use other means of TB control in addition to the vaccine. BCG scar is a surrogate marker of vaccination and an important index in the vaccination program. However, skull failure is a well-known phenomenon with prevalence of around 10%. Almost everyone, when given the BCG vaccination, will develop a raised bubble at the site of injection, which may disappear soon afterward. About 2 to 6 weeks after the injection, a small spot may appear at the site of the injection. It is normal for the spot to turn into a blister, which sometimes oozes before becoming a crusty scab. It's important to leave the area uncovered as the area will help to heal. The air will help it to heal, so we should not cover the scar. It is normal for it to leave a small scar. As I have said, around 10% of children who took BCG vaccination will not develop a scar because there are factors influencing scar formation after BCG vaccination. Those factors include vaccine-related and individual-related. Always we should have to focus on vaccine technique, handling, and mechanism of administration, technique of administration. And also individual factors such as gender, age, immune status, and the like. When we came to the main point, while it is correct to assume failed BCG vaccination if no scar is seen 90 days after inoculation, it does not necessarily mean that it had actually failed to induce some immune response that can be proved by laboratory tests. Having no scar does not mean the BCG vaccine is not working and it should be repeated. So having no scar does not mean the BCG vaccine has to be repeated. But few scholars says, since it is clinically impossible to distinguish between failed vaccination and failure to develop scar in spite of immune response, the better clinical option is to inoculate BCG a second time. Because inoculating BCG for a second time or revaccination with BCG has no side effect. Rather, it may give accelerated response. That means wound may develop at injection site or a scar is formed if we revaccination. But overall, having no scar does not mean the BCG vaccine is to be repeated because there is some immune response. Thank you.